those suffering from neck pain have different options when it comes to treatment, but one of those options has actually been around a long time. So here to tell us more about the history of traction and how it's used is Dr. Richard Busch of Busch Chiropractic. So thanks for joining us.
Thank you as well.
All right, so let's start with kind of what is traction?
Well, traction is basically a cycling of a distractive force along the long axis of the spine, so the length of the spine. So as that's happening, it's pulling the joints apart. Traction was, they've actually found evidence that traction has been used as early as 3,000 years ago in Egypt. As far as that's concerned, here more recently, they started to do cervical traction back in the 1930s. They started doing even some clinics with traction for lumbar spine in the early 70s. But it's been used over the course of history for many, many years. As far as that's concerned, the idea behind it is if we can actually take some pressure off those nerves, it'll help people feel better. Go ahead.
Yeah, well, I was just going to say, has it changed over those years of it being used?
Oh, certainly. Everything's changed.
Yeah.
You know, as far as that's concerned, the original types of traction were just basically a constant distractive force. Then they had what was more of an intermittent, where you have force on and force off. You're probably familiar with some of the inversion tables and that type of thing. We see those advertised all the time. And as far as that's concerned, that actually helps to take some pressure off the patient's spine. I have patients ask me all the time whether they should use that or not. And in some cases they can, but if you have more of an acute disc problem or even a real chronic disc problem pain, generally speaking, that will actually aggravate the pain a little bit more. And along with that, you asked about concerns with that. Patients over the age of 60, we have to worry about them possibly even being more plagued by stroke or something like that while they're upside down. But then they also have different types of what are called ambulatory traction devices, which can actually be worn, and they create a little bit of a traction force while patients are moving.
No, what's the DRS protocol?
The DRS protocol is actually an advancement on that very, very old technology. And basically, when we look at traction, we can see that the joints on the back side of the spine are pulled apart just gently, okay? Now, what we've found over the course of years is if we apply that force differently, we can apply a lot more force. So instead of just pulling the joints on the back side of the spine apart, we can actually pull the entire disc level apart. Oh. And as we do that, it helps create a pressure gradient between the inside and the outside of the disc and allows us to bring everything that disc needs in to heal.
Awesome. Well, thank you for all that information today. You can find out more about Busch Chiropractic by calling the number there on your screen. You can set an appointment that way as well. We'll send it back to you, Pat.